Hello and welcome to Championing the Public's Health.
Children are not put on earth to eat nuggets. You know, we've only got really ill in the last 30 years. If child health was put first in every department of government, that plan would have been different. This country would be different.
How do we affect people's behaviour? How do we make people think slightly differently?
Lots of services at the centre of them is about inspiring and educating people about good food.
Food does taste better when you can eat it yourself.
The most rewarding part of what we do is working with young people, because you really do see a change, especially when you put them in a slightly different environment which is slightly out of their comfort zone.
You can take the learning that you have in the classroom and take it into the field the very next day. So you're applying in practice what you've learnt in the classroom straight away.
I've been looking forward to this day, meeting students from all over the world, a classroom on the global stage, meeting them today. In fact, it's a day to remember.
To have longer exposure to patients, to understand patient pathways, and to understand the reality of changing things or improving things within the healthcare system. And I think that really is a core skill to being a better doctor.
Definitely going to be a leader of the future. I think this is kind of helping me just to see what I can do and what I'm capable of and what we're capable as medical students.
We need to develop more vaccines, and we need to really push the science and keep going and invest.
Many patients often aren't aware that they are eligible for vaccination.
Using vaccination as a tool in the fight against stopping antimicrobial resistance from emerging.
The number of deaths associated with drug misuse has more than doubled in this country over the past 20 years, and that should be a clear sign that the current strategy is not working.
Criminalising people who have a problem with drugs is only ever going to make their lives more difficult.
We have a situation where 3 out of 4 young people identify that they are very anxious about speaking to their peers in relation to self-harm or in relation to mental health in general.
They don't want to just be looking at one small part of their lives, like their drug use or their alcohol use. They want to be looking at everything in total.
Alcohol, yes, is a huge part of the client base for the Safe Bus.
We want to run pubs and bars that you can bring your mum to. If you can't bring your mum, then we're doing something wrong.
It's about training staff so that they're confident to challenge people each and every time.
Health inequalities is a lost potential. Lost potential for people leading happy, healthy lives, lost potential for the country and for the communities.
Nurses are asking patients about their money worries when they come in and referring them to the money advice service.
We're training young people to talk to each other about what matters to them.
It's up to us to get this information, spread it to people with young minds.
It's vital that young people are inspired by other young people.
It's really important that schools understand the health and well-being of their learners. We know that children who are emotionally and physically well engage better in teaching and learning and then get better educational outcomes.
This is the best source of data we've got about children's health in Wales, and it's really useful in helping us to see about the new and emerging issues.
Getting more children and adults out being active will help and take some of the pressure off their public health within the county.
For some people, it's been a lifesaver.
It makes your legs stronger and your body a bit more healthier.
Active Cheshire's mission is to get 50,000 more people more active more often by 2017.
They're being active without having to think, oh, it's hard work.
It says fun and it will get you exercise and it's good for your heart.
We will change. We will get there. Because we have to. Collaboration is the name of the game.
And of course, the earlier we can provide good information about health, the better it's going to be over the long term.
If I can just help one person comes in here as a result of what I do and gets something, then yeah, job done.